Good morning. This is Mike Berkley, the founder and director of the Berkley Center for Reproductive Wellness, coming to you live from Midtown East, New York, New York. It is Tuesday, September 14th at 9:18 a.m. So this little video is directed to those of you who suffer with endometriosis and you're trying to conceive. So I'm getting more and more calls these days from patients who have had a diagnosis of endometriosis and have had a laparoscopy. Their tubes are good, and yet they still cannot get pregnant, and they're within a fertile age. In other words, these patients are 32, 33 years old. And so, of course, obviously, many patients that undergo a laparoscopic procedure to eradicate endometriosis do, in fact, get pregnant, but many don't. And then the question, therefore, remains, why not? And so here's a possible answer. Endometriosis is an autoimmune disorder. I won't go into a whole explanation of endometriosis because you already have it, and maybe you even know more about it than I do. But the point is that when a woman has an autoimmune issue like endometriosis, she may have other subclinical autoimmune issues that heretofore have been undiagnosed that can negatively mitigate one's chances of getting pregnant. I'll give you an example. A woman should not have an elevated amount of activated natural killer cells circulating in her uterus. Activated natural killer cells are an autoimmune factor that not only do bad things but also do good things. But when activated natural killer cells are behaving inappropriately, they interact with other cells that then spray something called tumor necrosis factor onto the embryos, thinking that the embryos may be cancer, and they kill the embryos. And there are many autoimmune issues that can interfere with fertility or that can even cause miscarriage. And so if you have a history of endometriosis and you're young, meaning that your day 3 hormones are within normal limits, and let's say you're 34 years old and below, and you've had a laparoscopy or two, and you still can't get pregnant, and there's no other issues, and there's no male factor, my suggestion is to talk to your reproductive endocrinologist about getting a test called a reproductive immunophenotype panel. This test will determine if you have any other autoimmune issues that are negatively impacting your chances of conceiving. I am a licensed and board-certified acupuncturist as well as a board-certified herbalist. I'm the first acupuncturist in the United States to specialize in treating those with fertility challenges. If you'd like to schedule an appointment, or even if you just like to talk to get more information, don't hesitate to do so. My number is 212-685-0985. Our website is berkleycenter.com. That's BERKLEY center.com. Don't give up, ever forward. You can do it, and you will do it. I look forward to speaking to you soon. Have a great day. Bye.